Again, my name is Jack West. I'm a medical oncologist at Swedish Cancer Institute in Seattle, the founder and president of GRACE. I focus on lung cancer, see a few other things, but it's my pleasure to be introducing folks and moderating this next hour or so. And I wanted to start with a thanks to the supporters of the forum. We have that here. Just to call out Ariad, AstraZeneca, Astellas, Boehringer Ingelheim, Genentech, Guardant Health, Trovagene, and Smart Patients. I really want to thank all of the faculty who have been part of this and are continuing to be part of this, especially Dr. Camage, who has really done a tremendous amount of work to develop the whole program. And I want to thank the University of Colorado Cancer Center staff, especially Erica Matic and Vicki Mackey. I have thankfully not been that much of a part of the practical aspects of managing this. It's been a struggle to do, but I'm happy to have been delegating. But the people who I work with on GRACE, including Carly Bauman, Lisa Giannini, and Denise Brock, who have been doing a ton of the groundwork for this, have just told me constantly about what a pleasure it's been to work with the University of Colorado staff here and Dr. Camage. So thanks to all of those folks. I want to mention, you may have seen some of the information for Smart Patients, which is an online group and a discussion forum that I would encourage many of you, if you're not already involved with it, to become involved with. Gilles Friedman, who has been involved with online patient education for decades. He actually was the person who started the ACOR, the first online boards before they were, even, it was just Unix-based green screens back when he started it. But Smart Patients is the new iteration of a great user interface that I think is going to do very well as it potentially aggregates patients with different subtypes and on various medications to be able to share information and ideally to identify themselves as available for clinical trials to move the field forward. Gilles is also a phenomenal photographer, and he's here doing portraits both for Smart Patients and as part of GRACE's Lung Cancer Awareness Month campaign, which is coming later this year in November. And so I would strongly encourage and actually implore many of you to have your portraits taken. This is not just you with a selfie. This is art, and they're phenomenal things. And this is really trying to give a different face to lung cancer. And when we're talking about trying to engage people and how to move the needle in lung cancer, it's about not just engaging the people in the room. It's getting people outside of those most directly touched by it and changing the perceptions of lung cancer. And that's going to come from things like our initiatives on Lung Cancer Awareness Month and Smart Patients working on getting the word out and getting images out on the new face of lung cancer. So please, directly across from this exit and entrance is where you'd get your portraits done, and I would definitely hope and encourage everyone to do that, including the Lung Cancer Awareness Month, just showing what you're thankful for, because I think there's a lot to be thankful for these days in the field. The next thing I want to do is offer our first GRACE Lung Cancer Champion Award to Chris Draft. And for everybody who was here this morning, I'm going to bet you remember him, okay? So Chris Draft is the founder, president, and CEO of the Chris Draft Family Foundation. Now, he founded Team Draft with his wife, Keisha Rutledge Draft. She was diagnosed with lung cancer in 2010. And many people, I see folks in my clinic who sometimes don't manage the strain of a terribly difficult disease, even when they've been married. So, he and Keisha were not married at the time when she was facing all of this and unfortunately getting sicker. And he didn't leave her there. He stayed deeply involved, grateful for all of the time they could spend together. And they were married in November of 2011. There's footage on his website and on YouTube of their wedding, and it is remarkable to see. A woman walking down the aisle with a wheelchair behind her for support. And it was a very powerful event. And they were married, and she died a month later. And I will say that, just about everyone in this room has been touched by cancer in some way. We have it ourselves, our loved ones, or we treat it all day long. And it certainly is important to us. But the key is making it important to other people. And just as Chris didn't leave Keisha, they were married, they stayed together for every bit of that, he didn't stop his commitment to lung cancer then. He has remained involved, and he has been an ambassador for lung cancer to people who haven't been touched by lung cancer and haven't been, who just haven't felt that connection. And he is, for those who really don't know the backstory, he had 12 seasons he worked as an NFL linebacker, a great long career, beloved by his fans, beloved by other players, and really took a lot of fortitude to be able to play for 12 years. And he remains deeply connected to the NFL and has been working to create inroads between the NFL and the lung cancer community. And I know that many of us feel some mixed feelings about October being awash in pink, including in the NFL, and that lung cancer is the #1 leading killer of women as well as men in the United States, more than breast cancer. It's not a competition, but we want there to be awareness of lung cancer. And thankfully, Chris has been a tireless, dedicated person in raising awareness and changing the conversation and bringing a hugely powerful spirit. His outreach to hospitals around the United States has been leading to funding research, collaborating with advocacy and organizations including Grace, Longevity, and Livestrong, raising awareness of lung cancer and molecular testing for patients with the disease. It's really our honor to have him here today at the forum. The entire lung cancer community is grateful for all of the work he does. So with that, let me welcome you up and thank you very much. Thanks for all you do. Tenacity. Let me tell you, the only bad thing is I hate getting my picture taken next to him. It's really it's really a hurt.